Greetings, I'm Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings, and I'm pleased to welcome you to the multimedia summary for the journal's July 2025 issue. There are 3 articles that have been selected as our Editor's Choice or Highlights articles this month. The Editor's Choice this month is an original article entitled Early Onset Gastrointestinal Cancers and Metabolic Risk Factors: Global Trends from the Global Burden of Disease Study 2021. It is authored by Dr. Pjotr Danpanichkul from the Department of Internal Medicine at Texas Tech University Health Sciences Center in Lubbock, Texas, and the Immunology Unit in the Department of Microbiology at Chiang Mai University in Chiang Mai, Thailand, and colleagues from universities in China, Japan, Singapore, the United States, and Thailand. Early onset gastrointestinal cancers, cancers occurring in people in the age range of 59 to 49 years, may have distinct clinical features and pathogenetic underpinnings and are of rising concerns. Understanding the adverse impact of and risk factors for these malignancies is thus important and timely. In the current issue of Mayo Clinic Proceedings, and using data from the Global Burden of Disease (GBD) study, Danpanichkul et al. Determined the mortality, incidence, and disability-adjusted life years dailies for early onset GI cancers, and the mortality and dailies for these cancers ascribed to diabetes and increased BMI. The latter 2 conditions were hypothesized as relevant risks. Their findings demonstrate that in 2021, the year of the most recent updated version of data in the GBD study, there were approximately 500,000 incident cases, almost 300,000 deaths, and more than 14 million dailies due to early onset GI cancers. These data place the incident cases, mortality, and dailies of early onset GI cancers as approximating 10%, 8%, 16% respectively of all GI cancers. Between 2000 and 2021, the age-standardized incidence rates increased for early onset colorectal cancer and for biliary tract cancer, while such incidence rates between these years tended to decline for other early onset GI cancers. Notably, in 2021, more than 20,000 deaths from early GI cancers were attributable to metabolic risk factors, and the age-standardized death rates for early GI cancer from metabolic risk factors increased for all types of these GI cancers. These data demonstrate yet another set of diseases that are predisposed to by metabolic risk factors. The pro-cancer effects of obesity and diabetes reside, in part, from the inflammatory milieu created by both, and from the growth-promoting cell signaling pathways instigated by insulin resistance in diabetes, and from the lipotoxic cellular effects resulting from obesity. This study of Danpanichkul et al. Emphasizes the significance of early onset GI cancers in general, and the rising incidence of early onset colorectal cancers in particular. The relevance of these important findings ramifies widely to the need to understand how metabolic dysregulation promotes cancer, how lifestyle, diet, exercise, and decreased alcohol intake may mitigate such dysregulation, the care of the individual patient presenting with GI symptoms, cost-effective cancer screening, healthcare guidelines, and public health care policies. Our first highlight article this month is an original article entitled Midwest Urban-Rural Differences in Cancer Prevalence. It is authored by Dr. Christine Preissel from the Division of Epidemiology in the Department of Quantitative Health Sciences at Mayo Clinic in Rochester, Minnesota, and colleagues from the University of Minnesota, Minneapolis, Minnesota, and Mayo Clinic in Rochester, Minnesota, and Scottsdale, Arizona. From a global perspective, the prevalence of specific cancers varies from country to country. Such variation may be linked to specific exposures, such as tobacco smoking and air pollution for lung cancer, or to dietary issues such as a high intake of red meat and a low intake of fiber for colorectal cancers. But what about the relative regional prevalence of cancer within a specific country? In such studies, the regional divide is often based upon findings in populations residing in urban or rural areas. For example, Centers for Disease Control and Prevention (CDC) data demonstrate that non-metropolitan populations have a lower incidence of cancer, but a higher cancer mortality compared with metropolitan populations. Understanding the regional prevalence of cancer is relevant to the provision of healthcare. Preissel et al. Examined this issue using the Rochester Epidemiology Project to examine 27 county regions of Minnesota and Wisconsin. Communities were categorized as urban core, large town, small town, or isolated rural. Analyses were stratified by rurality and directly standardized by age and sex to the total 2020 U.S. population. The data demonstrate a higher prevalence of Hodgkin lymphoma among isolated rural residents compared with urban residents, that men in large towns compared with men in urban areas had a higher prevalence of throat cancer, and that women in rural areas had a higher prevalence of colorectal, anal, and ovarian cancer compared with women in urban areas. Preissel et al. Underscore the following consideration in their discussion, among others. First, regional differences occur as regards cancer prevalence, even between counties in contiguous states in the United States. Second, environmental exposure may underlie the higher prevalence of Hodgkin lymphoma in rural communities, as the use of pesticides in agriculture is implicated in the occurrence of such malignancies. Third, the higher prevalence of throat cancer in men in large towns may reflect such risk factors as diet, viral infections, and/or alcohol intake. Fourth, sex-specific cancer prevalence patterns may occur. Fifth, there is significant regional heterogeneity in cancer prevalence that goes beyond the conventional rural-urban divide. An important conclusion of the study by Preissel et al. Is that as rural communities may receive suboptimal health care, attention needs to be directed to improving the level and quality of preventive, proactive, and reactive health care for cancer in such communities. Our second highlight article this month is a letter to the editor entitled Persistent Hypoglycemia and Lactic Acidosis in Lymphoma, Implications of the Warburg Effect. It is authored by Dr. Leshuang Chen and colleagues from the University of Texas MD Anderson Cancer Center in Houston, Texas. Chen et al. Describe a patient with mantle cell lymphoma with persistent hypoglycemia and lactic acidosis. Evaluation of the hypoglycemia and lactic acidosis failed to reveal commonly expected causes. The patient's physicians reasoned that both were a manifestation, the Warburg effect, of a particular phenotype that may be adopted by cancer cells. Normal cells rely predominantly on oxidative phosphorylation to generate adenosine triphosphate, ATP, by utilizing reducing equivalents as a source of electrons to drive the electron transport chain. Oxygen is utilized as the final electron acceptor in the electron transport chain. These reducing equivalents largely come from the TCA cycle. Through the glycolytic pathway, glucose generates pyruvate, which is converted to acetyl-CoA, the latter entering the TCA cycle. In this way, glucose utilization relates to the TCA cycle, oxidative phosphorylation, ATP production, and oxygen consumption. The Warburg effect, described in 1927 by Otto Warburg, is the avid consumption of glucose and the attendant generation of lactate rather than pyruvate by cancer cells, even when oxygen is readily available. The Warburg effect enables cancer cells to adopt a phenotype that promotes their survival and proliferation, rather than a phenotype geared to producing ATP, as it is in normal cells. The Warburg effect may promote the following: rapid production of ATP, albeit in much lower amounts than oxidative phosphorylation affords, rapid utilization of nutrients in synthesizing cell components needed in assembling daughter cells during mitosis of cancer cells, specific cell signaling that drives cancer cell proliferation, and the condition of the cancer cell's microenvironment such that cancer invasion is facilitated. The Warburg effect, as highlighted by Chen et al., is relevant to various settings, among others, as this effect may underlie unexplained hypoglycemia and lactic acidosis in certain clinical conditions, is a strategy capitalized upon by positron emission tomography scans in cancer detection, may enable cancer cells to escape immune surveillance and removal, and may be the cause for resistance of cancer cells to chemotherapy. You can access these highlights and editor's choice articles free of charge during the entire month of July. We invite you to visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org, where you'll find our online-only features and many news stories posted in the News from the Editor carousel on our website homepage based on articles published in Mayo Clinic Proceedings. You will see other free content as well as articles published online in press. You will also find links to our social media by clicking the links in the gray bar at the top of the home page from the Connect menu to follow us on X and YouTube. On our YouTube channel, you'll find full-length author interviews called Insights and our MCP 60 seconds video article synopses. Another feature of interest on our home page is a collection of articles that honor the past and look to the future in anticipation of our upcoming 2026 centennial celebration. In addition, our website also includes our Mayo Clinic Proceedings issue summary and Author Insight podcast recordings, which are available from our website on the home page as well as through iTunes. As always, we greatly thank you for your interest in and your support of Mayo Clinic Proceedings. We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.